Hi, this is Dr. Abhinaya Vijay Kumar. I am a doctor and a motherhood empowerment coach. Today in this video, we are going to discuss how to increase your hemoglobin during your pregnancy. Let's get started. First and foremost, let us understand why is your hemoglobin getting reduced during your pregnancy. All of us or most of us start with a normal hemoglobin during the initial few weeks of pregnancy. But as pregnancy advances, we tend to have a hemoglobin drop. Why is this happening? This is because as the baby is getting bigger and bigger, we should meet the demands of the growing fetus as well. So the blood supply has to be increased. The same 5.5 liters of blood cannot serve both you and your baby the purpose well. So what happens is hemodilution, which means your blood gets diluted in order to increase the quantity of blood so that it can serve you as well as the baby, because of which your hemoglobin drops at least 1 or 2 points during your pregnancy. As doctors, we always advise the pregnant women to start on the iron supplements at the end of the first trimester or at the beginning of second trimester. Why don't we give iron supplements at the initial weeks of pregnancy? Because sometimes iron supplements can cause nausea and vomiting in few women, which is a very common side effect. And as pregnant women itself has nausea and vomiting more during the first trimester, this can further aggravate the problem. That is the reason we start by the end of first trimester where nausea vomiting comes down, or at the beginning of the second trimester. So, what can you do to increase your hemoglobin or to maintain the same hemoglobin throughout your pregnancy? First and foremost is the iron supplements, the medications which is prescribed by your gynecologist. Do take it regularly without fail. First, if you skip your doses, that is not going to help you on the long run to maintain your hemoglobin. Second, do not take it in empty stomach because this itself can cause nausea and vomiting, which may have a bad effect on your mind, so that it poses a threat that if I take iron tablet I am going to have nausea and vomiting. That's because you took it in the wrong way. So do take it along with your food or just after the food to reduce the symptoms of nausea and vomiting. And this also increases the bioabsorption of the iron in your body. Second is your dietary supplementation. You need to concentrate on your diet from the very beginning of your pregnancy to include green leafy vegetables, drumstick leaves, spinach, beetroot, pomegranate, dates, fig, etc. in your diet regularly, such that if regularly these are included in your diet, it is going to help you maintain that hemoglobin or to improve your hemoglobin if your hemoglobin is reduced. Always take fruits as a whole rather than taking it as a juice to increase the bioabsorption and to get the right nutrients from the fruits. And if you are a non-vegan, definitely start taking mutton spleen rather than mutton liver. It is always advisable to take mutton spleen. Why? Spleen is an organ where hemoglobin gets stored, not just in us, even in animals as well. So when you take mutton spleen, that is the richest source of iron. So when you take it regularly, that's going to help you improve your hemoglobin in your pregnancy. So I would always advise a mixed diet of both vegan as well as non-vegan if you are a non-vegan. Regularly, like mutton spleen at least once or twice in a week throughout your pregnancy, and spinach you could include at least on the alternate days, which means weekly thrice, and daily you could take some quantity, at least 4 to 5 of dates, fig, pomegranate, at least one whole fruit, and beetroot whenever possible, at least like twice or thrice in a week. If you take it regularly throughout your pregnancy, this will definitely help you maintain the hemoglobin, or it will improve the hemoglobin if you have anemia. How much should be your normal hemoglobin in pregnancy? Usually in women, if the hemoglobin is more than 11, it's well and good. But Indian women always have a low hemoglobin compared to that of other country women. So anywhere about 10.5 holds good throughout your pregnancy. So anywhere in first, second or third trimester, if your hemoglobin is dropping or not maintained, you should take utmost care to increase it by dietary supplementation, regular intake of iron medication, as well as following up with your doctor regularly. What will be done if your hemoglobin is low? In the initial first or second trimester, if your hemoglobin is low, doctors will always advise you to take dietary supplementation along with iron supplements if you were started on it, to take it regularly. So as I told, do not skip your iron medications and do not take it in the wrong way. so that even if you take, it's not going to help you. Do take it in the right way to increase the bioabsorption and also to increase your hemoglobin. So if your hemoglobin is anywhere 9, 9.5, your doctor will advise you to take medications. But if it falls anywhere 8 or 8.5, your doctor might advise you to take twice dose of medications. If you are in early pregnancy or if you are in mid-second trimester, you would be asked to take iron injections, which is iron sucrose injections, at least like 4 doses or 6 doses depending upon your HP level. But if your hemoglobin falls below 7.5, your doctor might advise you for blood transfusion, because if it improves 1 point after a blood transfusion and it comes to 8.5 or 9, after which we can maintain it by taking iron sucrose or by iron tablets. But if it's anywhere less, 7.5, 7 or even 6, that is going to have a lot of effect on your health as well as on the baby's growth and development. So do follow it up with your doctor and follow their advice, take necessary steps so that you can maintain the normal hemoglobin. Even after blood transfusion or iron sucrose infusion, if you're not going to have a healthy diet in place, there is always a tendency for you to fall back into the trap of anemia. So in order to avoid such repeated problems, have a special concentration on your diet. Have a balanced diet with the ingredients I mentioned earlier in this video. So do take it regularly in order to reap the benefits and to maintain your hemoglobin. So before I close this video, there is one common doubt from many mothers across the globe who are living outside India. Like here, moringa leaves, which is drumstick leaves, are not easily available. Can I take moringa powder? If you ask me, genuinely, moringa powder is not equal to the fresh moringa leaves. So it's always better to take it in a fresh way whenever possible, wherever you get it. Along with it, kindly take fig, dates, pomegranate, beetroot as well as mutton spleen regularly. This is going to help you on the long run throughout your pregnancy to maintain and to increase your hemoglobin. I hope you found this video useful and informative. If you have any doubts and clarifications, or you have any suggestion on my next upcoming video, do comment it in the comment section. I am going to read each one of them and respond it accordingly. Until I meet you in the next video, stay happy, stay mommified.